Welcome to the Scan and Plan Tool instructional webinar. This video was developed by the Chronic Disease Prevention and Control Program at the Nebraska Department of Health and Human Services. The hope of the video series is that it will provide a comprehensive overview for your organization to successfully complete the Scan and Plan tool. The video series consists of 4 videos, each of which could be viewed as standalone files to be able to understand the Scan and Plan tool. The first video focuses on introducing the video series as well as the Scan and Plan tool while offering some general instructions for how to complete the tool. We'll do a specific look at the Instructions tab included within your Scan and Plan tool as well as the General Information tab. The background and context video will be for any organization that wishes to have a better understanding for the intent of the Scan and Plan tool. We'll talk about how the program developed the tool and also how it fits into the CAPI framework that's utilized by our program. The third video does a deep dive into the strategy specific and action planning tabs included within your Scan and Plan video. We'll go through each portion included within each of those tabs and provide tips and suggestions for how to effectively complete that. The final video is actually a demonstration video where we'll walk through how to complete the tool in Microsoft Excel, allowing us to highlight some of the auto-population and auto-formatting features in the file. You are currently viewing the first video, which is focused on the introduction and instructions for the Scan and Plan tool. As we mentioned, we wanted to start by providing a background on the video series itself so you can understand the purpose. There were essentially 3 objectives that came to mind as the Chronic Disease Prevention and Control Program was developing the video series. The first is that we wanted to provide background on the purpose of the tool. Our hope is that by having a sense for why we developed the tool the way that we did and the intent behind it, your organization will have more success in utilizing it to its fullest capacity. The second objective is to describe all the instructions for completing the tool. Through this video series, we'll offer step-by-step instructions, suggestions, hints, and guidance for completing each tab, giving your organization a comprehensive understanding of how to complete the tool. The third objective was to provide a demonstration for how to complete the tool in Microsoft Excel. The file utilizes a lot of auto-formatting and pre-populating features, so we wanted to be able to highlight what it will look like as your organization completes the tool in Microsoft Excel. One important thing to keep in mind as you're viewing the video series is that the screenshots you see and even the demonstration tool that we use may not match exactly what your organization received for a Scan and Plan tool file. That's likely due to a variety of reasons. First, each tool is customized based on the health condition and grant strategies being addressed by your organization. As you might imagine, the tool that we have in place for diabetes prevention looks different from what we utilize for hypertension management. Second, sometimes files can be pre-populated with information and data our program has already received. We primarily do that as a way to streamline data collection for organization, though it also helps us validate the information that we've already obtained. Third, there may be additional tabs within your Scan and Plan tool, especially if you're applying for a funding opportunity through our program. This allows our program to collect additional baseline data needed as part of the project period. Finally, it could be the case that we've made general updates to the Scan and Plan tool based on feedback we've received from organizations who've utilized the tool. Anytime an agency utilizes a Scan and Plan tool, we love to hear about what that experience was like. In addition to hearing about what worked well, we also like to hear recommendations and tips for how we can modify the tool to hopefully make it more user-friendly for organizations in the future. It could be that we've made updates based on feedback even you've provided for our program. Regardless of what the screenshots in the Scan and Plan tool look like though, please note that this video series provides general enough guidance for how to utilize the tool effectively. And now we'll transition to providing some general instructions for how to complete the Scan and Plan tool. The first step will be assembling your team. We developed the Scan and Plan tool with the intention that an organization would pull a team together to collaboratively work through the tool. That would allow you to have a comprehensive understanding of what's currently in place at your organization and collaboratively determine what action steps could be taken as part of the project period. As you're assembling your team, it's important to review some of the statements that are included within your Scan and Plan tool, particularly in the strategy specific tabs, and take into consideration the intended outcomes of the strategy that your agency would be addressing. Knowing that information will help you consider who has knowledge about or a vested interest in that particular topic area. It could be, for example, that someone within your organization has a really solid understanding of the policies in place or of a particular topic area. We first implemented the Scan and Plan tool back in March of 2020 with 16 clinics. Among those clinics, they found that it was incredibly helpful to have a provider, a nurse, a care coordinator, and/or a clinic manager as part of the team completing the scan and plan tool. You could also take into consideration any program coordinators or external partners relative to the scan and plan tool topic. For example, a lot of our diabetes prevention work focuses on the National Diabetes Prevention Program, or National DPP. If that's the case for your organization, you may want to include the program coordinator for National DPP, the lifestyle change coach, or any external partners who are referring to or even offering the program as a way to have a comprehensive understanding about what's in place relative to the topics included in your scan and plan tool. Once you've identified who should be completing the scan and plan tool, you can then determine the most effective approach for getting it completed. Some of that may be dependent on how much time your team has to come together to complete the tool. We first implemented the scan and plan tool in March of 2020 with 16 clinics. Through that experience, we found that each strategy-specific tab took about 30 to 45 minutes to complete. That means that if your organization has 3 strategy-specific tabs included on your file, it could take anywhere from 2 to 3 hours to complete the full tool. Knowing that allows you to figure out how you want to bring your team together to make sure that the full tool is completed. Again, through our experience in March of 2020, we found that clinics took a variety of approaches to bring their teams together to complete the tool. The first approach was to schedule a block of time to bring the full team together to go through the entire tool. That may mean scheduling a 3 to 4 hour window of time to bring your full team together just to get it all done in one sitting. The second approach was to schedule a series of meetings or add on an agenda item to already standing meetings to address one strategy at a time. So instead of having a 3-hour meeting, you have 3 separate meetings to come together to complete the scan and plan tool. There was also a hybrid approach that was taken by a handful of clinics. They essentially started with a smaller team of 2 to 3 individuals, and those individuals would complete the full scan and plan tool. That file was then sent out to the larger team for review and feedback. That way there was comprehensive input on the tool, but you didn't have to bring all 10 members into one meeting to complete the scan and plan tool. That could be a time-effective approach for getting the tool completed within your agency. We wanted to point out that while it may seem like it could be a time saver to have each person just fill out their own tool, it's important to keep in mind that the information would still need to be aggregated so that there's only one final tool to reflect your agency's current policies, practices, and procedures, as well as their action plan for the project period. Really, the intent of the tool is still that teams within an organization are coming together to have conversation about what's in place and where they'd like to go as part of the project period. So to the degree possible, we encourage you to bring small teams at least together to have conversation about the scan and plan tool as you complete it. When you bring your team together to complete the scan and plan tool, it's helpful if everyone has an understanding of the process for completing the scan and plan tool. This slide provides a high-level overview about what you can anticipate and the process that you go through for completing the tool. The first tab within any scan and plan tool file will be for instructions. That's there as a reference for the intent of the scan and plan tool, as well as scoring criteria your team will need to complete the strategy-specific tabs. The second tab will always be general information. That's where your agency will need to complete a handful of fields about your organization, though some of that information may be pre-populated. We'll have more discussion about tab 1 and tab 2 through the remainder of the video. The strategy-specific tabs are the most time-intensive and collaborative parts of completing the scan and plan tool. Often when we talk about needing a team to complete the tool, this is what we're referencing. The tabs will be tailored based on what your agency's scope of work will be with the Chronic Disease Prevention and Control Program. And as we mentioned, there's a separate video that dives into the core components included on the strategy-specific tabs. The final tab that's included within a scan and plan tool is often for action planning. We encourage you to review and complete that at the very end of the scan and plan tool process, as some of that information will be pre-populated based on information you have on the strategy-specific tabs. The other important thing to note is that your file may contain additional tabs if our program needs to obtain baseline information from your agency about that project period. We currently do not have videos or descriptions of those, but if you have any questions or need assistance, you can always feel free to reach out to the Chronic Disease Prevention and Control Program. The other important thing to keep in mind about your Scan and Plan Tool Excel file is that you may be prompted to enable macros or enable content, depending on whether you're using a Mac or a PC. It's incredibly important that each time your agency selects Enable Macros or Enable Content. That's what will allow all the formulas, macros, and auto-populated features to work within your Scan and Plan file. If for some reason those prompts don't pop up, please reach out to the Chronic Disease Prevention and Control Program to ensure the Excel file will work appropriately. We'll now transition to take a closer look at Tab 1 and Tab 2 of your Scan and Plan Tool file. As we mentioned, the first tab included within your Scan and Plan Tool file will be specifically for the instructions. That way your organization has an easy reference to the scoring criteria and general intent of the Scan and Plan Tool. When you first open your file, the first section that you'll see is an overview. That highlights the funding source that's supporting your work as well as summarizes the intent of the Scan and Plan Tool in the event anyone within your organization needs a quick snapshot about the intent. The second section is focused on the instructions for completion. There we highlight how you go about completing the tool as well as the structure for the strategy specific tab so you have context for what the remainder of the tool will look like. Part of that context includes the scoring criteria your organization will need to complete the strategy-specific tabs. We'll cover additional context and provide examples within the strategy-specific tab and demonstration video, but this just highlights what you should see on the instruction tab of your Scan and Plan tool. Essentially, there will be a series of statements included on each strategy-specific tab, and your organization will be asked to reflect on to what degree they have policies, processes, and procedures in place to address those particular statements. You'll then score based on a 4-point scale ranging from not in place, which is in the red, to fully in place, which is in the green. There are two aspects that you can take into consideration when you're trying to determine which bucket your organization falls into for each of the statements. The first is to what degree things are written or documented within your organization. Selecting fully in place would imply that your clinic or your organization has a policy or a process or procedure is written out so that any staff member would know what the standardized protocol is for addressing that particular statement. Not in place would indicate that there's no policy, nor is there a type of formalized process or procedure to address that statement. Under development would indicate that there's been some conversation or consideration to a policy or procedure, and partially in place would mean that something is in the works to hopefully be formalized in the future. The second thing that you can consider is what proportion of staff are implementing the practice utilized in the statement. Fully in place would indicate that all staff members or all providers are already doing it, regardless of whether there's a written policy or process in place. Not in place would indicate that no providers, no staff members, no one within your organization is implementing that statement. So those are just some guiding principles that you can use when you get to the strategy-specific tabs. We encourage you to look at the instructions tab of your specific Scan and Plan tool file, as the language may vary based on the topics that your organization is addressing with the Chronic Disease Prevention and Control Program. The other scoring criteria that's outlined on the Instructions tab is specific to the action steps that you're generating for each of the strategies. We'll provide additional context as well as examples within the Strategy-specific tab video and the demonstration video, but we at least, again, wanted to highlight the instructions that are included on that very first tab of your Scan and Plan tool. Essentially, for every strategy that your organization will be implementing, there's a spot within the strategy-specific tab where your organization can brainstorm potential action steps to take as a way to advance that strategy. For every action step that's brainstormed, you then are encouraged to reflect on 4 different elements. 1, how important is that action step to advancing the strategy? 2, how expensive is it to implement the action step? 3, how much time or effort does it take to implement that action step? And then 4, feasibility, or how difficult would it be to implement that action step during the project period. Our hope is that by reflecting on these 4 elements, it will serve 2 purposes. 1, our hope is that it will help your organization prioritize which action steps should ultimately be included in your action plan. You'll notice that there's a column within the strategy-specific tab that says AP activity. That's where you're able to indicate, yes, this action step will be included in the action plan for the project period, or no, this action step will not be included. For any action step that has yes in that column, that action step will automatically be pre-populated into your action planning tab. This is a way for us to better connect the information on the strategy specific tab to the action plan that your program will ultimately implement as part of the project period. The second purpose that this serves by having additional data is that it gives the chronic disease prevention and control program context for the activities that are proposed, both those that are included in the action plan and those that are not. We can look across organizations and strategies to see which types of action steps are more costly to implement or more time intensive to implement, allowing us to better understand the scope of work and then report it to our federal funders. The final section included on the Instructions tab of the Scan and Plan tool is just tips for working in Excel. We provide keyboard shortcuts for you to be able to use things like bullets or hard returns so that when you're filling in open-ended responses within the Scan and Plan tool, you have a better way to format it. We'll try to highlight these during our demonstration video as well so you can see where it might be applicable to use them as you're implementing the Scan and Plan tool. As we mentioned earlier, the second tab included in your Scan and Plan tool file will be for general information. That's where we have specific fields for your agency to fill in, letting us know what your organization name and location is. In some cases, that may be auto-populated if we already have that available. As applicable, we'll also have organizations, and in particular healthcare organizations, indicate the total number of providers within their organization. If that's a data field that's included on your Scan and Plan tool file, we'll include a description for CDC's definition of provider. We also ask organizations to indicate the date that they completed the Scan and Plan tool and the process that they utilized to complete the tool within their organization. Earlier in this video, we outlined a variety of approaches that teams could utilize in order to complete the tool. This is where you'll describe the approach that you took, whether it was a 3 or 4 hour long meeting or broken up into a series of meetings, and also be sure to indicate the staff members who participated in this process so we have context for who helped complete the Scan and Plan tool. Also noted on the screen is that there may be additional data fields based on your agency's scope of work, especially if you're focused on identifying priority populations or high burden subpopulations. If any clarification is needed on the fields included on the General Information tab, please feel free to reach out to the Chronic Disease Prevention and Control Program for additional descriptions. As we bring this video to a close, we wanted to provide some general suggestions for effectively utilizing the Scan and Plan tool. The first are a couple of things that we mentioned in the video earlier, but are reminders that bear repeating. First and foremost, please remember to enable the macros or enable the content within your Excel file. It's incredibly important for your Scan and Plan tool to function properly, especially when it comes to the slick features of being able to auto-populate what's included in your Action Planning tab. If you're having trouble with the macros or content, please feel free to reach out to the Chronic Disease Prevention and Control Program so we can troubleshoot that issue. The second is that it's going to be really important to take into account the total amount of time it will take to complete the Scan and Plan tool and reflect on who should be part of that completion process. Again, when we implemented this tool in March of 2020 with 16 clinics, those healthcare organizations found that it was incredibly valuable to have a provider, a nurse, a care coordinator, and or a clinic manager to make sure all those perspectives were reflected as they were going through the Scan and Plan tool. And that transitions really nicely into the final general suggestions we have about how to best implement the Scan and Plan tool. As I mentioned, our program first implemented the Scan and Plan tool in March of 2020 with 16 clinics. As part of that process, we conducted focus groups with 4 clinics to hear about their experiences so that in part we could find ways to modify the tool and share their experiences with other organizations who might be utilizing the tool. By and large, the clinics did feel like the tool helped them meet our desired outcomes of the tool, which you'll hear more about in the background and context video, but many noted that the tool is ultimately what you make of it. Many of the clinics went in with the mindset that this was just something that had to be completed. It was kind of a checklist item. And in hindsight, they wish they would have been a little bit more intentional with how they assess themselves and develop the action plan based on the information. We encourage you as you're going through the Scan and Plan tool with your team to be really thoughtful and intentional with how your organization is assessing yourself and how that connects to the action plan for the project period. The second portion will make a little bit more sense when you get to the strategy-specific tab video, but also it's important to keep in mind that a low score doesn't necessarily mean that you're not performing well. As I mentioned, within that strategy-specific tab, one of the first sections allows your agency to reflect on to what degree you have policies, processes, and procedures in place within your organization. Ultimately, at the end of that section, you'll get a final score. Again, a low score doesn't mean that you're not performing well. It just means that some of those policies and processes may not be formalized or in policy form within your organization, and that's okay. Our intent with this tool is to really help organizations identify changes that they could make to hopefully make policies, processes, procedures more sustainable so that regardless of who's staffed or employed at your organization, there's some formalization and sustainability in place. The third recommendation we receive from clinics is to really utilize any sample tools that are provided. In most cases, we do try to provide a sample completed tool so organizations can see what the final results should look like. In addition to having that context, it can also be helpful to take a peek at some of the action steps that were generated as part of the action plan. That might also spark ideas within your organization about things that you could implement through your project period. Last but certainly not least, please feel free to ask questions if something isn't working. If you feel like something should be auto-populating or something isn't adding up correctly, please feel free to reach out to the Chronic Disease Prevention and Control Program. We're happy to answer any questions or provide any assistance you may need as you're going through the Scan and Plan tool. We encourage you to reach out to the Chronic Disease Prevention and Control Program at the email address listed on your screen so that your request can be fielded to the appropriate team member to help with your request.